Hello everyone, this is Sayer G from GreenMedInfo.com, and we're taking a look today at the cannabis portion of the research dashboard for GreenMedInfo.com. You can get here just by visiting GreenMedInfo.com because we're now featuring the research that's been at the heart and soul of our project here for about 8 years. Now if you go look at the left hand side, you see the therapeutic substances index. You have 1,689 different substances that we have indexed research on. The top most here listed are those with the most research supporting their use in the prevention and treatment of disease. Now this isn't a statement we are making because of course we cannot practice medicine and it's against the law to state that you can use a natural substance for improving your health. That isn't necessarily constitutional, but it is the law. So what we've done at GreenMedInfo is we are letting the research speak for itself. And as you can see, the cannabis section here can be obtained just by clicking the cannabis name. And then when we'll get to the actual data here, which I feel is very compelling for the ultimate mission of getting the truth out about this amazing healing substance. Now, this is a preview page. You do not have to be a member of GreenMedInfo to access all of these abstracts. You can see by clicking the plus button here, you can extend out to see the human, if it's a human study type, the date published, etc. And of course, if you click any of these links, you will get the full study abstract on our site. And I'm just going to take a second to load here. Now, just so everyone knows, on the right hand side, you have listed all the different diseases that we have found research to support its potential or actual use for. Now on the right, you'll see our section for the abstract. Now keep in mind, if you click the what's called PMID number, you will actually go directly to the National Library of Medicine, which is what we love because again, GreenMedInfo is a pass-through site. We're not here to get you all stuck up in our system. Hopefully, we're just hoping to realize our mission of spreading awareness of how much research already exists at the National Library of Medicine's PubMed.gov. Remember guys, this has 25 million citations in the biomedical and life sciences. This is the world's compendium of research on really all medical topics. The complementary and alternative medical filter contains several 100,000 abstracts relevant to quote, evidence-based, natural, or integrative medicine. So what we've done, of course, is try to make this a little easier. Now, for those who would like to see the professional membership access levels, let's hit login real quick. And this is something that we created over the years, hopefully to make the job of researching easier, as well as to amplify the access that is already available, but saving you hundreds of hours of time. Because really, ultimately, each section on the site was several days, weeks, or months of me spending a lot of time on PubMed.gov, searching through all these amazing abstracts, enjoying every moment of it, quite frankly, but making it so that you could come back and get it all in one spot. So here you'll see we have what's called Get Focus. So say you just want to know what research exists on cannabis and breast cancer, immediately you'll see it come up. You have 17 articles for a total cumulative knowledge count of 32. Now, just so you all know, this is not just the number of studies, obviously, otherwise it would say 17. It's the quality and the quantity. Quality is determined by a human study, for example, is more important than an animal study. So we score it that way to give you a quick snapshot view of the relevance of the research and how much, quote, gravitas exists to support an association like this. So, of course, you can hit focus and you'll see the abstracts here, instead of just being arbitrarily all the different benefits, we'll just flip to breast cancer only. Give it just a second. Now keep in mind, our site uses several different servers. It's a MySQL server system, and so there's some delays that we're working with right now, but we're just about to launch for our 7-year anniversary, and at that point things will be much quicker. So you'll see the 17 articles below, and of course when you're logged in like you are and you click on one of these abstracts, you're going to be able to actually save to My Research whatever you like, so you can kind of come back quickly and get back to it. So here we go. We're going to hit My Research. So now it will be saved over in the My Research section. So that way you don't have to go to some external system to take notes, for example, like Evernote. And then, of course, PubMed itself has a pretty good bookmarking system, but it's external to our dashboard, so we don't want to keep you set there. So here's a good look at what the collection will be like. So let me go back here. One of the things that I really enjoy a lot about our system is that you have the ability to publish the results publicly. So of course, we open up the public version, and I'm also going to download a PDF, let that crunch a little bit. And what this is going to do is, say you're a writer and you're writing about the benefits of cannabis for breast cancer. Instead of having to go in and hit up, 17 different citations, you could just link to the public page. And this is a responsive page, which means that if you're on a mobile device, it'll kind of like adjust to whatever particular size of the screen, from an iPad to an iPhone. So you'll see listed here the different research study types, the different topics that are referenced, and then of course the actual studies. And what you can do now is you could send an email to your physician. Let's say that you're someone trying to advocate the position that cannabis should be used for breast cancer. Well, here you go. Just copy paste. Or you could, of course, share this to Facebook. And that's one of the things we're trying to really maximize is utilizing research so that people can share it easily and disseminate it. Now, on the other hand, we have downloaded a PDF. And this is a custom PDF now that you could send off to a practitioner, for example, or somebody that just wants that research in one spot instead of having to go through and search all these abstracts. Because let me show you real quick what's entailed here. If you go to PubMed.gov, you're going to actually have how many come up for cannabis. All right. 15,000. I mean, it's a huge amount of data. So going in there, drilling down to each abstract, finding the ones that actually have positive results, takes time. And so what I've done is try to make it easier. Of course, we still have quite a lot of research still to index, and that's a big part of our goal. It's also why we really appreciate the support of members, because without you, we couldn't even afford to pay our hosting fees, much less create these new tools. So let me go back. Oh, by the way, I want to show you don't have to go to the front page. We have adopted an open access platform Twitter has offered to the world for search, so it's an automatic search. And this will take inventory of 10,000 different health topics on our site. So really quickly, I want to show you, we have here 250 different diseases that cannabis has been studied for having potential value in. And so, of course, GreenMedInfo is an archive for the research that generally helps us support the movement to make available cannabis as a natural alternative to pharmaceuticals. And it's not just about pain. We're talking about things like, deadly brain cancer. Glioblastoma has a 2-year survival rate on average, and that's after aggressive treatment with chemo, radiation, and surgery. Well, it turns out cannabis has cancer stem cell killing abilities, so technically is far superior to chemo and radiation, which actually enrich this highly malignant subpopulation of cancer cells. So we're talking about a huge amount of potential applications. Dementia, for example, a lot of new research on Alzheimer's, neuropathic pain, all types of different cancers. So clearly, by concentrating all the research, what we're hoping to do is really bring forth the advocacy of, cannabis is sort of the centerpiece today of the movement forward as far as people having access to safe, effective, affordable alternatives to drugs. And of course, you have pharmacological action. So look, 57 studies on the neuroprotective properties of cannabis. And again, that's why we love our focus feature, because if you were to try to look through all of the research and go through hundreds of abstracts, it's just not convenient. So here you can kind of drill through, or again, you can create public pages. So again, everybody, I really would love more people to know about this resource. We created this video in part for the cannabis community so that those advocating for medical marijuana can have a resource that will help support them. And for those in the conventional mindset that are looking for the research, because that's the bridge here, right? Evidence-based medicine is the dominant meme. Natural medicine, synthetic medicine, we can at least meet in the agreement that if there is published and clinical research supporting an intervention, well then there shouldn't be so much vitriol and so much, name calling, quite frankly, when it comes to being able to use what was fundamentally the most ancient medical system on the planet, which is natural medicine. So again, Sarah G from GreenMed Info, thank you, and please come and use our resource whenever you like.